That's perfect. Okay, we'll go ahead and start that. And off to you, Erika. Thank you.
Awesome. Thanks for that lovely introduction, and thanks everybody for coming today. I hope you can see my screen okay?
Looks perfect. Okay. Thank you.
Awesome. Yeah, so I'm excited to talk to you today about a topic that is near and dear to me, which is wondering where policy is in current dissemination and implementation science research. And so I'm going to talk a little bit about a paper and also just a general approach to thinking about policy level factors in implementation science that some of my colleagues and I have been working on and recently published in implementation science. And I wanted this to be a really practical discussion, so please do feel free to unmute, ask questions as they arise, put them in the chat, although sometimes it's hard for me to see the chat while I'm presenting. But let's make this interactive, ask tough questions, ask easy questions, whatever you need to make this useful to your work and relevant to what you think about with D&I methods. I put a worksheet in the chat. I hope folks are able to access that just kind of summarizes some of the recommendations that I'm going to present on today with a little crosswalk to help you think about how you might employ these recommendations in your work. So feel free to follow along here or with that, whatever makes the most sense. Okay. So I would just first acknowledge that science is a team sport, and this was a team sport. So this was done with the incredible Rebecca Legnick-Hall, who was on the call, as well as Nicole Stadnick, Dr. Mullen, and I realize there's a misspelling in her name, so I will fix that. Apologies for that. And Dr. Greg Ahrens also. So this is a paper you can read in Implementation Science, and we'll talk about it today. But a lot of this, this is a debate paper with a proposed sort of recommendations for optimizing theories, frameworks, and models. And a lot of it really came out of just practical research experience, thinking about some NIDA-funded work that all of us are engaged in, as well as some of our conversations at the Implementation Research Institute. And I'll also just acknowledge that I did not have the resources to make these current slides 508 compliant. So please let me know if you would like an alternative version of this information. I'd be happy to provide that in some capacity. Okay. So let's talk about policy implementation. And I want to just stress that it's not a new thing, right? I think sometimes in dissemination and implementation science, we like to think that we're sort of presenting new things. And in some cases that may be true, but implementation science is by nature very interdisciplinary, and it comes from a lot of different fields. And that's just follows suit for implementation of policy or dissemination of policy level things. So public administration has been studying policy implementation since the 1970s. That's a great field to look at if you have questions about this kind of area. You also see a lot of policy implementation in the economics field. You'll see studies about the implementation of federal policies, like economic development programs, for example. Public administration and economics, they do tend to look at variables that influence the success or failure of policy implementation to achieve a policy's intended goals. Another field, political science, focuses on how policymakers and citizens make political, economic, and social decisions about how public policies are designed, implemented, and disseminated. So there's a lot of literature and knowledge that we can draw on as we introduce policy level considerations into our D&I space. And I just want to acknowledge that what we're presenting today is not new. It's not particularly novel. It just draws on our interdisciplinary roots. And I wanted to provide a little short list of policy-focused journals that I particularly enjoy reading regularly for folks who might be newer to thinking about policy in their research and wondering where to go. The Journal of Health Policy, Politics, and Law is one of my all-time favorites. It's going to read really differently than, say, Implementation Science or JAMA, things that you might be more familiar with. There's a lot more in-depth discussion about the politics, the polity structures, and the policymakers themselves behind each discussion that they present in those works. And then the Journal of Public Administration Research and Theory is also quite good and might feel a little bit more familiar if you're used to reading more medical journals. And then there are just some others that are listed there, and reach out if you have more suggestions or questions about any of these. So you might be wondering, how neglected is policy in the D&I space or in public health in general? You might be saying it's not that neglected, but I assure you it has. And the fields of political science and public administration have really repeatedly called on public health scientists to go beyond measuring the impact of a policy on health outcomes and really intentionally examine how policy and politics are influencing the delivery of health services or the implementation of some evidence-based or evidence-informed thing. And so here are just a few of some of my favorite articles that have provided a nice critique of our kind of inability to include policy and politics in a meaningful way into public health research. I also think, there's something to be said about the inherently political nature of public health and health promotion. I think a lot of times when I present on these topics at conferences specifically, I get some pushback saying, but we're researchers, we don't deal with politics, we don't deal with all of that. We want to stay, in the research bubble and not get entrenched in any of that partisanship stuff. But anytime you choose to fund one initiative or focus on saying we should implement this evidence-based thing, you are inherently saying that we are not going to focus on something else, or we're not going to spend money or political capital on something else. And that inherently is a political decision. So I would just encourage us to think about really placing our research in the real world rather than a fictitious place where health interventions are politically neutral. And as you can see from just a collection of fairly recent news clippings, there's a lot of politics in our health policies. I also hear this misnomer a lot. If policymakers would just use the evidence, we would have better, evidence-informed practices or evidence-based practices available. And I think that that is a dangerously naive view of policymakers. I think on the whole, policymakers are rational actors. It's just, we might not agree with what they are, rationalizing their decisions on. But public policy making, it's not a linear process. They don't just get information and evidence and then act on it. There's a lot of back and forth. And I think we could be sympathetic to that because that's often how implementation feels. There's a lot of circular, a little forward motion, a little backward motion. And whenever you have that kind of nonlinear process, a lot of other things come into play. So the idea of evidence-based policy is a little bit of a misnomer, right? Policies can be informed by evidence, but they're also informed by a million things. They're informed by resources, political capital, what constituents want. And so saying that something should be evidence-based is a little unfair because there's often way more that has to go into policy than just the scientific evidence. And here's just a few other things. One thing I think about specifically with policy dissemination research is that it's great if we want to help inform the evidence behind policies, but the onus to do that is really on us as researchers, right? We have to do a really good job communicating data that policymakers need in the right way at the right time. Or we can't assume that they're going to read our journal articles because I promise they're just never going to do that. And we also have to be mindful that the outcomes of interest to us might not be the outcomes that they need to make their argument on. A lot of times I hear that policymakers are saying, I keep getting information for the effectiveness of this or the equity behind something, and that's all well and good, but what I really need is information on cost effectiveness or, efficiency of something. So I think we should just think a little bit about what are the competing demands for our evidence, right? It's finances, it's political capital, it's personal beliefs, morals, societal values, and I'm sure the list could go on. And if folks have ideas, I'd encourage you to put those in the chat. I would also say that, I spend a lot of time talking about health policy, and I think a lot of us might on this call, but if we really consider a health in all perspective, that should encourage us to look at all sorts of policies. So a health in all perspective basically says that it sort of focuses on the social determinants of health, right? Like just because a policy isn't squarely focused on your health, it could be about a transportation policy, but that may have implications for your health outcomes or health equity issues. So we should be considering the politics and evidence in all of these different types of policies that are being created, not just health policies specifically. Okay, so I want to think a little bit about the role of policy in D&I research right now. So we can think about policy in a couple of different ways. Typically, we say big P policy and little p policy. So big P health policies are things like laws, regulations, administrative actions by government agencies typically, but they could also be done by large organizations. And then little p policies typically are those from organizations themselves. These could be smaller things like a tobacco-free campus, right? That's a health policy at an organizational level, or a little p policy. And these policies, whether they're big or small, have a huge impact on how we access care, the quality of the care that we receive, the individual patient and public health outcomes of something, right? But I would argue, and several have, that the role of policy in dissemination and implementation science has really not been addressed in a super meaningful way, or it's been understated and largely ignored in many cases. I think typically in D&I science, we focus on, we can think about upstream as policy and downstream as individual health outcomes. And my critique of our field would be that D&I science has really traditionally focused on sort of midstream quality and care gaps, which are really important to solve. But there's a huge stream we need to look at, and there's room for others to think about branching out as well. So there's this great study by Kimberly Hoagwood and her team at the IDEAS Center, where they talked about defining different types of policy D&I studies. So there are formative studies of policymakers that really get at when, how, and why they might use research, contextual factors that influence their decision-making process. You might be familiar with the really great work of Jonathan Pirtle. He does a lot in this space. Then you could also look at dissemination effectiveness studies of policymakers, where people create and test dissemination strategies for their ability to change the way policymakers use information or use evidence from researchers and develop evidence-informed policy. That's typically where my work tends to land. We could also think about policy process implementation studies, right? So this is around how evidence-informed policies, like once we've already gotten evidence into the policymaking process, how are they implemented? What are the barriers or facilitators to policy implementation? These tend to be sort of observational studies, and I've also done and published in this space as well, if you have questions about that. And then a really exciting area that I've seen a lot less in are policy impact implementation studies. So really testing strategies to implement or de-implement policies that are hopefully evidence-informed. And basically, I think the big idea behind doing any of these studies is that if we can really think about specifying the role of health policy in these D&I efforts, we can improve thinking about all of the different policy-related variables that might go into making a policy successful. And we can accelerate the impact of implementation and accelerate the impact of public health outcomes or population-level outcomes that can lead to a healthier, more well-being in our society. So this brings us to a question, which is, what is the role of policy? What role is policy playing in any D&I project, right? They could be the evidence-based law, rule, policy, or thing, as Jeff Curran would say, at the center of our implementation efforts. And that's typically how I like to think about policy, but that's not the rule, right? Policy could be several things, and I really like this causal model from Kara Lewis and her team. So I stole the model, put it here, and then I kind of filled it in with the different roles that policy might play. So policy could be the thing, right, that you're focusing on. But what if policy is a determinant in the outer or inner context that enable or constrain dissemination or implementation strategies from achieving your desired outcome, right? What other causal pathway roles might policy be playing? Could it be a mechanism, for example, the process that the strategy is operating through to affect an outcome? Or maybe if you're thinking about a formation study, could policy be a distal outcome that you want to affect? We have a study right now in Oregon that Dr. Ahrens is leading where we're thinking about, could policy change be a distal outcome that leads to sustainment of something else? So there's lots of roles that policy could play, and I would just encourage you to spend a little time thinking through what role that might be. But that's hard, right? Because anytime we start talking about causal relationships, causal models, theories, models, and frameworks, it gets scary. So let's talk about a couple of recommendations to work us through that. And I'll kind of give you a little bit more background on why these recommendations came up. I think that theories are great roadmaps for how we plan studies and how we execute studies. They give us a set of readily understood variables, relationships, and if you've ever applied for grant funding, you know that a theory, model, or framework makes your reviewer very happy, especially if it's optimized well and it's used to really explain your study. And our field loves theories, models, and frameworks. We have no shortage of them. Last time I checked this dissemination and implementation models and health website, there were 114 that we could choose from, and 26 of them claim to deal with policy on some level. But when I took a deeper dive into looking at some of these policy D&I frameworks, I noticed some issues. One is that they are very specific to a population or a setting. So there were a lot in there that were specific to nurses, which is kind of interesting. And that might be because there's a lot of nurse lobbying power. There were some that were specific to just general projects. People had made very specific frameworks for their projects. So those settings might not be transferable to your studies and might not be super useful for you to look at. There were a lot of frameworks in here that also just focused on implementation, but I'm really interested in what happens at all phases. And if we think back to Kimberly Hoagwood's sort of typology of policy studies, we can see that there's a case for looking at pre-implementation, mid-implementation, and post-implementation sort of sustainment, or if we want to use the EPIS language, there's a case to be made for thinking about policy across exploration, preparation, implementation, and sustainment phases. But a lot of our existing models really just focus on policy implementation, and that's not useful. And I think most of those do that because they're actually drawing from the poli-sci or the public administration literature itself, which is great, but it doesn't give us a complete D&I picture. So a model like that comes to mind is like Kingdon's 3 streams, which you might have read about in some other work. And it's a wonderful model for explaining how 3 factors come together to make policy implementation happen or open the window for policy implementation to occur. But I'd like to know what happens before that or what happens after that. And then my other gripe with the existing models is that there's a focus on just systems level policies or big P policies. And I think with a lot of our work, you know, organizational or little p policies are critical. And so we need some flexibility with how these theories, frameworks, and models deal with policy at really any scope. I'm seeing some questions in the chat, so I'm going to take a quick look while I pose this question to you. And I hope that people will also reply in the chat. Do you think, given the argument that I've presented about the need for more policy-focused D&I frameworks, theories, and models, we should create new ones or we should just optimize existing ones? And I will just preface this by saying that there really is no right or wrong answer here. There's just preferences. So reply in the chat, if you will, letting me know how you feel. It's hard doing this remotely. I'm looking for people's faces for reactions. It's a lot of names. Okay. Borsica, great point on considering what evidence means. I totally agree. Yeah. Are there ways in which we can improve on how we report on policy relevance in D&I models health web tool? Are there others we can add? That's a great question. I think that could be yeah, we should talk about that. Maybe something in the recommendations today would be helpful. I love that D&I web tool, by the way. I mean, it is really wonderful. Okay, I'm seeing a lot of option two. Okay, cool. I see an option one from Kristen. That's exciting. Kristen, can I put you on the spot and ask you why option one, since you're the only one that has put that in there, at least openly?
Sure, and I've done some work in this area in terms of scoping reviews of theories, models, and frameworks, and I think our constant attempt to rejigger models and theories that have been developed for other purposes, while I don't want to add to the theory model framework proliferation that we have, leaves us with these models that really aren't fit and don't well capture a lot of the dimensions that you've already talked about here, of the ways in which policy is different from an evidence-based intervention and the other influences that are equally important and lead to some of the dismissiveness of the determinants of policy adoption and implementation, because they are already oriented towards the other features that we think are most critical.
Yeah, that's a great point. And again, there's really no wrong answer here. It's personal preference, right? Like, I think that goes to a question of how well are we really optimizing for theories, models, or frameworks in general in our research. And Sarah brought up a great point. Like, sometimes it's really hard to take something that is, a theory offers a general set of variables and relationships in a common language that you can apply to your work, but sometimes it's really hard to do that. And sometimes people do it better than others. Sometimes, it doesn't just fit. So I think there's a question here in general about that. Yeah, we certainly don't want to create Frankenstein models that you're just, throwing stuff in and it doesn't really have a good fit or a good rationale. So I think careful consideration of however you do create a new model or however you do optimize one is extremely important. Okay, so I am going to say that my take on this is that I don't think that I don't have an interest in creating new theories, models, or frameworks. And it's not to say that people shouldn't, they could. But I think that the more that we have that are new and untested means we have even more science to do. And the projects, what can they really tell you about generalizability or transferability in terms of expanding our knowledge on existing theories, new theories? Like, I think, to Rebecca's point in the chat, we really need a good reason for new theories, models, and frameworks. And if you do have a good reason, then all the power to you. But I'm going to talk about the times when we might not have a good reason. And we'll kind of walk through that. So some pros to optimizing existing theories, models, and frameworks is that we're not reinventing the wheel, and we can advance theory by kind of testing and refining some of the relationships we posit to exist. And we can potentially use these existing theories, models, and frameworks and adapt them in ways to identify new outcomes, right? I think Enola Proctor and her amazing team at WashU wrote this very seminal paper about implementation outcomes, but never intended those to be the only outcomes we focus on. So I'm talking about adoption, acceptability, fidelity, things like that. And some of those outcomes might not be totally relevant for policy. There might be other outcomes that are more relevant that we need to be thinking about. So optimizing frameworks to look at different outcomes could be an unexpected and great benefit of this. Right? We might be getting a better sense of the outcomes that policy actors really care about and getting closer to closing that policy to research gap, or research to policy gap, pardon me. I think also there's something really hard about engaging policymakers in your work at any stage, right? So how do we engage them in our work when we're starting and really co-designing a project together? How do we engage them as partners in that way? How do we engage them as potentially participants in our study, people we collect data from? Or at the very least, how do we engage them as an audience for our study findings and share information with them? And so thinking through where these policymakers live in your theory, model, or framework could really help you figure out who the right policymakers are, when to engage them, what kinds of decisions they make, so what kinds of outcomes you might want to share with them, how to frame those outcomes for them in a way that speaks their language and is given in a timely way where they can actually act on that information. And just kind of, we talk a lot about, in Dr. Aaron's study, we talk about planning for sustainment from the start. And oftentimes that might mean partnering with policymaker, people who pull the purse strings. And so thinking about where those policymakers sit, their competing demands, their priorities in your framework from the start can help you think about how to engage them for those sustainment conversations down the road. So as I mentioned before, this was a team effort with Dr. Legnick-Hall, Dr. Stadnick, Dr. Moulin, Dr. Ahrens, and I, and we did this scoping review to look at how policy was used in different theories, model, and framework-driven research for D&I studies. And we focused our work on how people had used the EPIS framework specifically to do their D&I research at a policy level. And that gave us a little bit more narrow of a scope than looking at how any policy D&I study had been done. So this was for practical reasons, right? Because otherwise the scoping review would never end, because a lot of people just sort of mention policy somewhere in a D&I study, whether or not it's the focus. But also EPIS is a really practical choice to use because it is one of the most widely cited D&I theory, model, and frameworks that's been used in over 1,600 publications. It looks at a lot of different phases, and because it's neutral on its topic, population setting, potential for policy scope, people have used it in a variety of studies. So we looked really at any study that ever cited EPIS, and if they addressed policy in any level. Did they address, policy as a big or little policy influencing the implementation effort, or as the thing itself? Did they mention the role of policy in the outer context potentially, or the inner context? Did they mention a policymaker, some other type of policy actor? Did they mention the policy environment where something else was being implemented? Did they mention politics? Anything at all related to policy and its neighbors of politics and polity systems we included and we took a look at. And so here's sort of a flow diagram of what we found. We ended up with 96 studies to analyze for how they used policy, and I can get more into that if folks have questions. But for now, I'm going to skip past it because it's not the most interesting part. And Dr. Legnick-Hall and I really did a lot of data extraction, so I want to give her kudos for going on that wild journey with me. But basically, when we looked at those 96 studies, we said, what's the role of policy? What's it doing? Is it clear? Did the authors say policy is playing this role? Policy is living in this context. Or was it more ambiguous? Did they say, oh, the outer setting or the outer context is this broad policy environment? And sadly, that was the case in most places. We also looked and extracted data around the role of policy actors or policymakers, the role of politics, how they described outer and inner context. And then our wonderful team looked at all of these extracted data and kind of said, what kind of recommendations can we draw? And we used a consensus decision-making process to present the recommendations that I'm going to talk through with you today. I'm seeing more chat, so I'm just trying to check. And again, please do feel free to unmute if you all have questions. Are there policy TMS from other fields that could be optimized for D&I? Yes, I do think that's true, Elizabeth. So I'm going to present on recommendations today that we developed using EPIS, but I want to be really clear that I think that these recommendations are applicable to any theory, model, or framework that you want to use in the D&I space, whether it came from the D&I field directly or it came from public administration, political science, or something else. And Lillian, I see you wrote why EPIS. I think I just covered that, but let me know if you have more questions about that, and I'm happy to revisit that. Okay. Awesome.
Yeah, I think, sorry, this is Lillian. Related to my question, why EPIS, you did answer it, but I was also curious,
more in the context of EPIS's existing applications in the policy space. I guess I'm less familiar with this. And so maybe it is a widely used framework for policy versus like interventions. I don't know if you have any thoughts on that.
Yeah, so this was specifically a scoping review to look at any dissemination or implementation science study that addressed policy in some way for a D&I effort. So we weren't necessarily looking for policy researchers to be using EPIS to guide their work, although we certainly did find some of those. But really we were saying, how is the D&I field conceptualizing policy? And because EPIS is one of the most widely used frameworks in our field, we said, okay, if people are going to use it, EPIS at least has some consideration for policy in the outer context. So maybe people would be more drawn to using it for these policy relevant studies. And so we wanted to see how that was happening.
Okay, thank you.
Yeah, that was a great question. Okay, so I'm going to talk through the recommendations. And if folks have the worksheet that I sent via the chat, that could be helpful if you want to think through your own study. But feel free to unmute and ask questions or put them in the chat, and I'll try to get to them as we go through it. But basically, the first recommendation here is to specify the dimensions of a policy's function, right? So a function describes the fundamental purpose of the policy, and the dimensions that we want to specify are the policy goals, the policy type, the context, and the capital exchanged by the policy. So capital exchange could be like money or funding for some intervention, right? Funding for substance use treatment is often something I look at here as capital exchanged. But capital exchange could be a lot of things. It could be, you know, information, it could be power, it could be political capital. And if we think about what policy is doing in terms of its goal, if it's a big P, a little p policy type, or the context where it's happening and what kind of information or capital is being exchanged, we can start to think about the role policy is playing in D&I success and which domains and constructs it could occupy in our theory model or framework. So I often like to think about this question by asking myself, okay, what's the goal of or intent of this policy that is coming up in my work? And this recommendation really echoes early policy implementation research, which argues that correctly identifying policy goals is critical to determining whether policy implementation can be successful. So some of the ways that we might think about investigating policy's function, you can really just use a variety of methods that make sense for your research question. But, you know, we have this huge project going on that Dr. Ahrens is leading in Oregon. And one of the things that we've done to investigate the potential role of policy in that study is to say, let's do a landscape analysis. Let's look at websites for all of these policy actors and agencies. Let's look at the gray literature. Let's show up where policymakers are making decisions. Let's go to advisory board meetings, things like that. Let's do qualitative interviews. Let's get a holistic view of what is going on in the environment where this implementation study is occurring and see what roles policy is playing there. So you can often use legal document review, like policy budgets, or other kinds of documents to get a sense of what the goal of the policy is, because it's usually pretty clearly stated in those things, and also the type of policy. And then qualitative interviews are just a great way to get a richer understanding of the multi-level context that policy is operating in, and also what kind of capital is really being exchanged, right? Because there's the stated capital, right? Oh, this policy is being created to provide funding for vaccinations. But then there might be something else that's also happening with it as well. The second recommendation is to specify dimensions of a policy's form. And that's going to help you think through the structures and processes that influenced how the policy was developed and guide research measuring how specific policy characteristics might influence D&I outcomes. So a policy's origin refers to how the policy was developed and the stakeholders who were involved in creating the policy. So for example, you can ask yourself, is this policy being created by agency staff right? Which could include people from different backgrounds and experience levels on a topic. Or are they outsourcing policy creation to an expert work group? Is there a collaborative process with the public, like public forums where the policy is being created? Was the policy created by advocacy groups and presented to policymakers for adoption? I like to think about what kind of expertise the people creating the policy have, and who was in the room really when it happened. And so if policy is the evidence-based thing to be implemented, you can look at the EPIS framework here and think about specifying the innovation factors domain, looking at who the innovation developers are here. The second part of this would be to specify the policy structure, and this requires asking whether the policy is enforceable or effective enough to impact implementation. So you can determine if the policy represents a funded mandate or an unfunded mandate, right? That's going to affect really what kind of structure it has and what kind of backing there is for it. So an unfunded mandate would be something like, suggested guidelines, or guidelines that we'd like you to implement, but we're not going to necessarily enforce or provide any supports for you to implement. You can look for other structural factors that might impact the urgency of compliance of interested parties who have to adopt this. Knowledge about the policy structure, like what it specifically enforces, can also help you investigate the role that policy is playing in any kind of causal pathway you might want to investigate for D&I efforts, and whether it should be placed or where it should be placed in your theory model or framework. For example, in EPIS, should it go in the outer or the inner context or be the innovation factor itself? Part of specifying policy's role is also looking at dynamism. So this describes policy's intent and potential for permanence. And you can investigate if the policy is time limited, because that could also impact the implementation process and impact of implementation or its outcomes. So one example that easily comes to mind, hopefully, is COVID-19 mask mandates, right? They were commonly implemented as a time limited policy but over time, you generally saw a lot more public backlash and mounting political pressure to remove the mandate or let it expire. So we can think about dynamism and use it to also conceptualize how other potentially competing demands or influences that are happening within its own time of implementation, how those different factors might need to be included in your framework across outer and inner context. And I'll just kind of note that policies without time limitations, unlike mask mandates, for example, the kinds of competing demands or competing pressures that they might face over time will vary and can certainly influence policy longevity. So one way to look at this a little bit more clearly is to use something like legal mapping methods or document review to assess dynamism. And then the last thing I'll kind of say here is that you should measure or at least be thinking about outcomes related to a policy, right? And those might be intended outcomes, but also unintended outcomes of policy implementation. Things related to health equity come to mind here a lot for me. And this will help you think about the outcomes that you want to measure in your study. You might be saying, oh, my study is just really about fidelity or reach of a policy, but it might help you think about some other factors that might need to be considered in your investigation. And the kinds of implementation and dissemination strategies that might be necessary to support those outcomes of interest. Okay. See more chat questions. Monica says she likes core policy functions. And who is missing from the room. Monica, I won't take credit for who is missing from the room. That is something that Dr. Gracelyn Cruden has emphasized to Rebecca and I many a time. It's her wonderfully easy phrasing for thinking about who makes decisions about policy actors. And hopefully there's a paper coming out describing how to figure out who's in the room where it's happening soon. Yeah, thank you, Rebecca. Okay. Recommendation 3. So we talked earlier about how policymaking is not linear, and that's similar to D&I processes, right? So we need to be thinking about identifying the activities and the stakeholders that characterize each D&I phase and how those characters might move across phases. So recommendation 3 is to think about your framework in terms of identifying and defining the nonlinear phases of policy across D&I, outer and inner context. So we can use generic pre, mid, and post-implementation language, but EPIS gives us really helpful language here with exploration, preparation, implementation, and sustainment phases. And really the main point here is just to consider what the outer and inner context look like during each of those phases and how they change over time. What do we need to be measuring or accounting for in our implementation or dissemination efforts and strategies across these phases? Okay. So while recommendation 3 highlighted the need to understand how inner and outer context changes occur over time, this 4th recommendation is all about investigating how stakeholder roles and responsibilities in those contexts change over time. So just breaking this down to another level, not just the activities, but who the people are and what they're responsible for doing. So EPIS gives us really great language to start with. You can start by identifying the outer and inner context leadership, right? That's a familiar construct in EPIS. And you can think about the role of outer context interorganizational networks, advocacy groups, clients, and patients. And you can think about inner context frontline implementers, as well as intermediaries who might support implementation of policy across context. I'll note here that some policymakers or some stakeholders might be involved throughout the entire policy lifetime across exploration, preparation, implementation, and sustainment phases, or during more time-limited phases where they're making strategic contributions or having strategic responsibilities. The point here is that drilling down and knowing their temporal roles is really going to help you design implementation strategies or dissemination strategies tailored to those policy actors and what they're interested in doing or hearing from you. But it's not really just about policy actors, right? We know that when we think about the room where policy is being made or how it's being implemented or how it's being enforced, there are others in the room. There could be lobbyists, there could be different agencies represented, there could be constituents represented. We have to think through a policy life cycle to figure out who might be involved and at what time. Okay, so now we're going to think about what our models don't include and how we could adapt a theory model or framework to make them work better for our study or our policy D&I question. So I would argue in all of my experience using theory models and frameworks from D&I or really any field, I think they present an incomplete an incomplete organization of factors that impact policy D&I efforts. And when we did the scoping review, we found that very few studies really examined specific policymakers, political institutions, and the role of politics in D&I efforts. And so I often have to adapt these theories, models, and frameworks that I use in my work and add factors that make more sense to me. So some things that I have always added are the role of partisanship, right? We live in, if you're looking at US healthcare systems, partisanship is a huge factor influencing how healthcare systems are organized and how services are delivered and which services can be delivered and the geographic bounds around some services. We can look at political support as a different kind of level of partisanship, right? How much might a governor want to support a state agency or a state health department doing something? I like to look at stigma, not only around a specific disease or illness, but stigma around a specific type of service. A lot of my work looks at medications for opioid use disorder. So we not only have stigma toward people who are insured by the public Medicaid system, we have stigma toward people who use opioids, and we also have stigma toward people who use medications for opioid use disorder. So it's a lot to consider, and it's missing from our models right now. We can also think about outer context issues like workforce capacity and how is that impacting our implementation effort on a broad scale? How might that impact sustainment or scale up of our effort? Within the inner context, I sometimes like to think about what local services are available within an agency or an organization represented by the inner context. I think about what are their competing priorities, right? We hear a lot of times at provider organizations, they say, what's the flavor of the month that we're implementing? I have change fatigue. I'm tired of implementing a million things. So what are these competing priorities and how could we maybe include them in our models a little bit better? And something here, you know, Sarah brought up, it's sometimes hard to think about multi-level policy implementation. And so really drilling down what kind of adaptations need to be made to your inner and outer context. And one of those adaptations might be really recognizing that those contexts themselves are multi-level and dynamic. And that needs to be represented like it is here in this version. Okay, and then the last recommendation is around bridging factors. And we are so very lucky to have Dr. Langnet-Call on the call. She is our resident expert in bridging factors and was a huge help in drafting this recommendation. But really what we're arguing here is for folks to do a little bit better job identifying and describing bridging factors necessary for policy D&I success. So a bridging factor can represent structures, relationships, intermediaries, for example, and processes that support outer context and inner context alignment or help achieve policy transfer or help achieve general D&I success. And you're probably sitting there thinking, well, bridging factors is very specific to EPIS. That's a whole domain in EPIS. But really, we're starting to see this idea of bridging factors come up in several models. All it really is saying is that it's acknowledging some sort of alignment enhancing factor that needs to be there to span domains and enhance the fit of whatever you're trying to implement or disseminate, right? We can think about boundary spanners that work across context to promote implementation outcomes. That's a familiar example. So I like to look at what are the potential bridging factors that are going on in any policy D&I effort, right? Or do I start to see formal arrangements like contracts or financial structures being set up to ensure that somebody does something? Are providers getting, you must use evidence-based practices written into their contracts, requiring them to do this? That would be a formal arrangement from the outer context to the inner context to do some evidence-based thing. Are we seeing partnerships spring up to help make implementation go smoother or help with sustainment long-term? Are we seeing data sharing processes come to light where data collected across a variety of inner context is being shared with leadership in the outer context to help think through how a system can better function? There's a whole lot of different types of bridging factors, and I think this is an area really ripe for more investigation. And if you haven't read the wonderful article called Forms and Functions of Bridging Factors, written by Dr. Langnet-Call, I put the citation for it here on the bottom right. We have a taste of it in our recommendations article, but the longer form version is very much worth reading. So I want to make sure we have time for discussion. So I'm going to wrap it up a little kind of soon, but I just want to put a couple of notes. We've gone through a lot of theory here, but the big picture takeaway is that at the end of the day, a theory model or framework, whichever you choose to use, really needs to work for your research question. It should be a roadmap to help you and guide you, your investigative team, guide the relationships to the variables that you look at. And when I approach D&I policy level work, I'm not finding that. And so these recommendations were really created to help me think through the work that I'm doing and my colleagues are doing. And we thought they might be helpful for you. That said, these recommendations, they're not static. They can change over time. You can use some of them, you can use all of them. They do build on each other, but they're cumbersome to work through, as you might see in the worksheet that I sent. So you should consider how using each or all of these recommendations together might impact the quality or the scope of the work that you're set out to do and what you really have time for. In the article, we described way more methods that you might use to actually achieve some of these recommendations, right? So there's some recommendations around how social network analysis, landscape analysis, legal mapping, qualitative data collection, or ethnography, things like that could all be used to help support use of these recommendations. And I'll also just say that I think that these recommendations would be really fun to apply in fields outside of traditional healthcare systems. So you can think about them in terms of how they might be used around housing policy, D&I efforts, or criminal legal justice system reform efforts. And so I'm just curious if we can have a conversation about whether or not you think that these recommendations could be used in your work and how you might do that. And I promise this is my last reference to the movie Clueless. I think I had recently watched that when I made these slides, and so it was on my brain. But I'll invite people to unmute or come on video and offer some questions or feedback. Hey, Sarah, I see your hand up.
Yeah, I spent the greater part of yesterday with your article and trying to apply it. And so I was caught by the last couple sentences that said researchers may be hesitant to use all of the strategies in one research article. So I think you've clarified that you're saying you could use one, you could use all. It's just, it feels like a lot to use all of them, but we'll see if we can do that. So I guess I didn't really have a specific question, but we're trying to use this and sort of excited, but again, struggling with the, multi-dimension of the policies occurring across multiple levels. So.
Yeah, that's a couple of things to unpack here. Yeah, do you have to use all of the recommendations? I think, I think the worksheet might help see how you might work through those different recommendations all together. But, like any theory, model, or framework, not everything will be relevant to your study. And so it's about thinking, at least going through the mental exercise, is this relevant? Is this useful? Or can I check it off and say, okay, I thought through it and it's not useful, right? So there's different levels of using the recommendations as a mental exercise or to really pull out different policy actors, entities, or systems and place them somewhere in a framework. Other questions, comments? I see Jessica has a question. How important is it to adjust the D&I language based on stakeholders participating in the conversation? I saw a politician panel asked the difference between equality and equity. Not one could answer the question.
Hi, Erica. That was me. I want to say great presentation. Thank you so much. I really appreciated it. And yeah, so I wanted to just And I did see a presentation. It was attended largely by a lay audience. And so, with these conversations that we're having and with legislation that's being passed to kind of try to navigate equity and with like some of the things that are coming before the Supreme Court and all of those things, there was someone in the audience and they weren't trying to be adversarial in any way. They were genuinely asking the question, what the difference was between equality and equity. And no one on the panel could answer the question, which I found kind of disturbing and like shocking and horrifying at the same time, considering that's legislation that all of them see in front of their desk every day. So just curious how you kind of use language and then maybe modify language when you're having these conversations in order to like come across to different populations, whether it's patients or laymen or, those in the government world.
Yeah, that's a great question. I definitely engage in a lot of code switching where I talk one way to my research colleagues and a different way to my policy maker colleagues. I don't tend to show policymakers anything about theories, models, or frameworks unless they have any particular interest in that. It just doesn't resonate for them. And I'll also say that when I publish in policy or public administration focused journals, I have been told several times to cut my policy framework completely out of the article. And they're like, you can mention that you guided your research using EPIS. That's awesome. Good for you guys. Publish that in a different journal. But, cut that and use those, 500 words to give us a really thick description of the politics and partisanship entrenched in the background of your outer context. That's what we want to see. So whether it's actual policymakers or even other researchers from the more traditional policy fields, there's a ton of code switching that I do. And I find that with policymakers, I think that researchers generally do a bad job communicating with them because we try to sound really smart and like we have all of the answers. And so I generally try, when I talk to policymakers, to instead say, I think I understand the issues that keep you up at night and the different competing demands that you're under. And is what I'm saying, are these those issues? If so, I think I might be able to help in this way. And I talk like, I don't come from a family of academics, so I like to think about how I would talk about my research with either of my parents, and that's how I talk to policymakers. I don't use the same words at all. I don't tell them about study design or methods unless they ask in a more detailed way. So I think it's not dumbing it down. It's just speaking a totally different language and thinking about the things that they care about. I think I also would share a general rule of thumb I have. If I ask a policymaker for anything, I have to offer them at least two things. So if I ask them to participate in an interview, I say, would you like me to, prepare a brief summary of what I learned in bullet points for this project and give it to you? Or do you want me to comment on a policy for you or look at something for you? What could I do for you? So every time I ask for something, I give them two things in return because they're very busy.
That's great. Thank you so much.
Yeah, it's also because you can't pay policymakers to participate in stuff usually. So that's kind of how I pay them back with my time.
That's wonderful. That's great advice. Thank you.
Sure. It's a good question. Dr. Crane.
That's still exciting to hear. In any case, I'm just curious if you sometimes feel like you're fitting like a square peg in a round hole, applying some implementation science frameworks to policy, and if you ever feel like implementation science's like passion for models, theories, and frameworks is ever like too clunky or just like unnecessary. And, I know that they're helpful in many ways. I'm just curious kind of your thinking on that as you've been applying it to projects.
Yeah, I think I can feel like a round peg in a square hole in implementation science and also sometimes in public administration fields. I especially feel that way at conferences, right? Like when I go in a room full of political scientists, I feel like the least knowledgeable person in the room. And when I go into a room of implementation scientists, I feel like sometimes what I'm presenting is they are like, well, that's just policy. That's not related to what I do. And I've certainly been told in several conferences that I should stop thinking about politics. And I get that feedback from reviewers in my journal articles a lot too, and that it's not appropriate. I do think the tide is turning a little bit on this. And I don't think, I think that other people like Ross Brownson and Jonathan Pirtle have been pushing this part of the field forward for a while. I think the important thing to do is to not get honed into how D&I is looking at policy, but really go back to the fields that gave rise to D&I research, right? Going back to health services research broadly, going back to health policy, public administration fields, and looking at how they analyze policy, and then just bringing that to a D&I lens in our own field and kind of justifying the work from the fields that gave rise to D&I. That's been useful for me. I'm not sure if that answered your question though.
Yeah, thank you.
Oh, that's great. Thank you for posting that reference, Nicole. Alyssa asks, are there TMS from other disciplines, economics, poli-sci, that you've come across that you find useful or could be applied to D&I? Yes, a lot of people, like Jonathan Pirtle does some really cool work using Kingdon's 3 streams model, which explains when a policy window can open to allow for implementation of something, a new policy. That's useful, but I will say, coming from a background in health policy, nobody ever uses, like, the emphasis on theories, models, and frameworks in policy is very little compared to how much we emphasize it in D&I or other parts of public health. So there's not a ton to choose from, although they do exist. And I'm happy to share any references that might be useful for other models if Alyssa or others are interested.
Hi, I'm Alyssa. Can I ask a follow-up question?
Of course.
So I think that's really kind of profound that within, poli-sci or economic or other policy-oriented disciplines, there's not a lot of theories, models, or frameworks to choose from. To me, that I guess I want to ask you, do you think that there is a deficit, or do you think it's just not very practical and maybe not as useful? And then, so to that question, what is the utility of theories, models, and frameworks, I guess, here as well?
Yeah, that's a big question. So I wouldn't say that there's not a lot to choose from. There's just, it's not like in public health, we have so many theories, models, and frameworks. And then within all of public health subdisciplines, there are even, different ones that come up and hybrids of models that come up. So those other fields like poli-sci and health policy or public administration, they certainly have their own theories. But you just don't typically see them cited in every paper that comes out or as a way to analyze what's going on. There's more of a setting analysis or a rich description of the environment where policy is taking shape without necessarily citing a theory, model, or framework there. So I wouldn't say that there's a deficit or that they're doing a bad job. It's just a different approach within those disciplines. And then to your question about, what are we doing here? Why do we have so many? I think that we're a very interdisciplinary field. And so we try to understand relationships and variables in a big way, and how they talk to each other and what those look like in different settings and how they might impact our implementation success. And so it makes sense to me that we would use them to structure our approach to the world, right? That's all a framework is really doing, is giving you some set of variables to think about. Is this reflecting reality, and can we test it in some way? So I think they are useful. Health systems are organized in a few different ways, but it's not like we don't have any knowledge and we need a grounded theory approach to analyze what's going on with them. There are some variables that we can very clearly pull out and say, I think there's a relationship here.
That's really helpful. Thank you.
Sure. Susan?
Hi, I was just thinking, I think this whole discussion with the TMF, it's kind of like, that's the way D&I structures how you approach doing research and how you read research papers, and your brain starts thinking that way. You know where to look for what in it quickly, okay? Mm-hmm. General science has its introduction, its methods, and you know where each of those little sets are. I think public policy, and those are frameworks, we just don't call them frameworks. And so I think public policy also has frameworks. If you have a lab that says Public Policy Brief 101, why do you have that? Because there's a structure that the politicians like to read in, that they are comfortable with. They know where to look for things. They know how to compare it to something else that's similar. And so they have their own frameworks. They just don't call them the things that we do. And so I think each discipline has its own things. And like you said, because D&I is so interdisciplinary, that's probably why we have so huge a number of TMFs, because everybody's trying to decide which areas they're integrating, right? But it's not that the other areas don't have them, but in order to really be an effective communicator, you need to reach out to whoever you're talking to in their structure and format. And that's what makes them, if you, as a physician, I want to hear the one-liner, the history of the present illness. Then I want their med list and their past medical history and their allergies. And I want it in that order. And we train the medical students. That's the order I wanted it. And that's the way we all talk. And so it makes it easier. And does that mean I have a framework? Well, yeah, it is a framework. It's just not called a framework. But I think that's how if you want to talk to me about a clinical process and you talk it to me in that way, I get it a lot quicker. I've learned the D&I language to some small degree, so I get it a little bit. But I think it's just the politicians need to hear it in their structure, and you have to adapt your thought. You use that for your structure, and you pick the TMF thing that works for your structure for this thing. And then you have to, if you want it actually implemented, if you're implementing it in a different setting from where your research background is, you have to work in their setting.
Yeah, those are great points. Thank you for bringing that up.
And I see that we're now just past our time. I want to thank you, Dr. Crable, for this really rich and just interesting discussion today. Yes, huge thank you and a round of applause. We will be letting you all know when the recording is available on our DISC YouTube channel. And stay tuned for our May seminar presenter. So thanks so much. Take care, everyone. Happy April.
Thanks.
Bye.